I'm Dr. Sushma, consultant pediatric rheumatologist. Did you know that worldwide millions of people suffer from autoimmune and autoinflammatory arthritis? Today, let's try to understand these diseases better. May 20th every year is observed as World Autoimmune and Autoinflammatory Arthritis Day. So, what are these conditions? Let's try to understand. Autoimmune diseases are when our own body starts attacking our own tissues. Our immune system is designed to protect us from external infections, but when it starts attacking our own body by mistaking it as foreign, it leads to inflammation. This can be due to multiple reasons, but the exact reason is not exactly understood. It could be due to multiple risk factors such as genetic risk factors, environmental causes, infection, stress, and even lifestyle changes. Here, our body produces certain protein molecules called as antibodies that whenever there is an infection, these antibodies, which are targeted against those particular bacteria or viruses, are produced in the body, and they go on to attack those particular bacteria and viruses to get rid of them from our body. But in autoimmune disorders, even in the absence of these infections, our body starts producing these antibodies. And these antibodies might target our own tissues and cause inflammation. The typical example of these autoimmune disease, which is very well understood, is systemic lupus erythematosus, juvenile arthritis, and psoriatic arthritis. Here, when we do a laboratory test, we can see that there are particular antibodies that are directed against our own cells. The typical feature of an autoimmune or an autoinflammatory arthritis is that there is a joint pain and a joint swelling and stiffness and limited mobility. The peculiarity here is that the joint pain is more after rest and it gets better with activity. And there is a joint stiffness that is more pronounced in the morning after rest. When the child wakes up in the morning, there can be a stiffness that can last for more than 15 minutes, and child only gets better as the day progresses. Also, there can be swelling in the joints, warmth or redness. Along with other features of those particular diseases like systemic lupus erythematosus, or also called as lupus, might have fever, rashes, like red rashes over the face, increased photosensitivity, fatigue, weight loss, poor appetite, mouth ulcers, hair loss, and many more manifestations based on the organ that is inflamed. And also, depending on the condition, there can be inflammation either limited to the joint or in the blood, called as systemic inflammation. So let's understand what are autoinflammatory diseases. So autoinflammation is when our immune system that we acquire by birth, called as innate immunity, is erroneous. As in, we don't find these specific antibodies as in case of autoimmune diseases, like those particular autoantibodies or the cells which called as T cells, which are specific to our own self-antigens, are not found. Instead, the innate immune system, that is our immune system that we acquire through birth, which is designed to target many infections, is erroneous and starts producing inflammation. The characteristic here is that the inflammation is more periodic. So, the typical example of these autoinflammatory diseases producing arthritis is systemic arthritis. Systemic arthritis is when a child starts having arthritis of inflammatory nature, that is a joint pain, joint swelling, and joint stiffness. Along with that, there can be systemic manifestations in the form of fever, which is 1 or 2 spikes per day, and also rashes, red rashes that are more pronounced during the episodes of fever, and fatigue. And also on examination, child might have other features in the form of enlarged lymph nodes, enlarged liver, spleen, and other features. So when a child comes with joint pain or fever, the first thing that would come in a mind is either infection. If the infections are ruled out, the next thing is sinister causes such as malignancies. The rheumatological perspective only comes later on, leading to delayed or misdiagnosis. Early detection is very crucial in these conditions, as the golden opportunity to redirect the immune system is very important and during the initial phases of the disease. So understanding these diseases and suspecting these rheumatological diseases early on are very important. Also, another spectrum of autoinflammatory condition is called as periodic fever syndromes or recurrent fever syndromes. Here, there is recurrent episodes of fever along with other manifestation in the form of arthritis, rashes, abdominal pain, eye inflammation, and other features. The peculiarity here is that the child is completely normal in between these episodes. These occur as attacks of fever with a fixed period for 4 to 6 weeks in between, and each episode lasts for 3 to 5 days or more, and the child being normal in between. And these diseases, as these occur as just fever and abdominal pain, or just some joint pain or some mouth ulcers, it can be thought as just a viral fever that is more frequent in a child. So even if your child is experiencing any of these recurrent episodes of fever with inflammation when we do the blood test, we have to consider recurrent fever syndromes or periodic fever syndromes, which are most often missed. So the diagnosis is basically made based on the pattern of the symptoms and the clinical features along with the laboratory substantiation. So in the labs, we look for inflammation in inflammatory markers in the form of ESR and CRP, and we do certain immunological tests. Especially in autoimmune diseases, we look for these bad antibodies if they are present in the body, and we do the test to look for the same. And once the diagnosis is made, the treatment involves controlling the inflammation and also immunomodulation therapy. Immunomodulation therapy involves multiple options we can choose from depending on the disease, the nature of the disease, and the severity of the disease. And these diseases need to be detected early on so that the course of the disease and also the damage that can happen can be prevented. So by understanding these diseases and also expecting the features early on and thinking from a rheumatological perspective, we can detect these diseases early on, and a prompt referral is very important in these conditions. And also by understanding the perspective of the patient, by understanding that these conditions, which can be very challenging for the patient and it can be very isolating as well, which can have a significant impact on day-to-day activity of a child or a person living with arthritis. By understanding these diseases better and by sharing our experiences and also spreading our experiences as a patient suffering through these diseases, we can spread awareness about this disease and build a compassionate society.